Hi.
Okay, hi.
Can you see yourself in there?
Yeah, I can.
Okay.
Hi, my name is Colleen, and I'm exactly a year and a half today. And I'm from Oregon, and I came down in August, and it was so hot, and I've lost 110 pounds. So actually, my youngest turned 21 today. So I thought, okay, we're coming down to Las Vegas. So anyway.
So President Obama didn't dissuade you from coming to Las Vegas?
No, not at all. So anyway, yeah.
Thought you cancel your trip because Obama said don't go.
No. I'm fine. But anyway, so I had, like I said, I had the surgery in August of, it would have been 2007. Yes, and it has just been wonderful. I can't say anything.
Complications? Are you any ulcers or gastritis?
No.
Or upset stomach?
No, I do not absorb vitamin B12, so I have to have the B12 shots, which, you know, they don't really tell you that. When the first time I was tested, they said, oh, everything is fine, and I was really excited because I had other friends that had weight loss surgeries before, and they also have to have the shots monthly because your body does not absorb it, the vitamin B's, 12s, and some of the different vitamins. And I thought I was really lucky because I said, no, I'm fine, but my last results, I was not absorbing.
You have low B12?
Yes, and I take a B12 complex and a B12 dots.
And the dots.
Yeah, and like I said, the normal B's.
And do you also get a shot?
Yeah. Well, now I do get a shot. I just started the shots last month.
Okay. We get the lab data on thousands of patients, and B12 deficiency is pretty uncommon for our surgery. So it can happen. It can happen even without the surgery. But when you bypass the gut, we always worry about it. I've been surprised at how few of my patients have a low B12. When you got the low B12, the year before that, you were taking your vitamins pretty well?
I'm very religious about taking them all the time, yes.
Gotcha, okay. All right, good.
And
did they try you on the sublingual or the dots before they went to the shots?
No.
Or they went right to the shots?
Right to the shots.
Okay.
I'd only taken the dots for about 2 months, maybe. And that's only because another person, one of my litter mates actually told me about it. She lives in Seattle, and I'm from the Portland area. And so we have seen each other a couple times, and we talk to each other, which is very nice because there was four people had surgery on the 16th, and 4 people had on the 17th in that particular date. And we have kept on contact with 3 of us. And like I said, the one, Cindy and I, we talk, you know, a couple times a year or so, and we've seen each other, which is amazing. I remember sitting here like you and thinking, oh my gosh,
what am I doing?
What am I doing? And you know,
this
and this can't really, this isn't, yeah, exactly. And this really, is this going to work? Right. So anyway, like I said, it was wonderful, and I've been really pleased with it. I really haven't had any complications.
So the B12 deficiency, just as a reminder to everybody, it's uncommon, but that's why, remember, at 1 year, you're supposed to get your blood test and get that checked, because it can happen. It can happen even in people who don't have the surgery. So there are people who don't have the surgery. I think this may increase the risk a little bit, but we don't see it as often as we see the iron deficiency. How's your iron?
My iron's always been low, even before the surgery, so I do take a lot of iron supplements. But I'm totally fine on the iron, but I've always taken the extra iron.
There's a brand new iron. It's a new kind of iron that is much better absorbed. There is a population of people in the United States that have chronically low iron, and that's the people who are on kidney dialysis. And they're always getting transfusions and intravenous iron. And so there have been some new studies on some new iron formulations. So if you're interested, you might email me. I put it on the mailing list, and I've got some new stuff on it. One of my patients about 3 months ago was an oncologist, so he sees a lot of people with low iron, and he says the new iron is a really big jump in its ability to protect you from low iron.
Okay, yeah.
Because most irons that you take are poorly absorbed. And this new iron is really a positive development for iron therapy and may protect you from having that low iron.
Okay, I'll have to try that. But
Yeah.
when you talk about the website, that was the first thing before the surgeries. You're on there continually, and you're reading. And then afterwards, you're on for about 6 months. And then all of a sudden, if you go away for a weekend and you come back and there's, 500 emails, you're like, oh no. But then it just gets to be a little bit too much. So, but it is nice. I still do check in on the website every once in a while. But it is kind of overwhelming because if you do look at that site sometimes, and if you haven't been there for a while and you have literally 500-600 emails that,
Just erase and start again?
I know. Yeah, but then you can't do that because you think, what if it was important? So could have been something exciting. So.
You can always look in the archives.
Yeah. Oh, yeah. No, I don't think that far ahead, but.
But like when you go, you can search the archives by putting in a search term like iron, and you'll get a lot of my old. Or if you put in iron and Rutledge, you'll get a lot of the old comments on that that'll help on iron.
But it really is nice for those people that are thinking about surgeries or having it to really keep connected with that and keep connected with the people, because for a while there was 4 of us that did it for the first 6 months, and we're like, now what are you taking as far as supplements? And one of the girls is actually, she said not to say this out loud, but she's an insurance agent, and I said, oh gosh, I hate to think about going and doing all the blood tests because they're kind of expensive if your insurance doesn't cover them. She goes, I'm not supposed to tell you this, but she goes, just take out a life insurance policy and have all your blood work done, and then if you want it, that's great. If you don't. But that's another way of getting around it. So, yeah.
That's just getting a phone call from Prudential.
I was going to say, yeah. So.
A couple of patients that work for Aflac, maybe they'll get
Hey, Trish or Sandy, can we see about turning down the temperature? Is it warm in here to you guys? Or?
Yes.
Maybe you can see the...
Well, that's one thing. Since I've lost 110 pounds, I'm always cold. I'm freezing all the time, and that's another thing, because people don't recognize you when you've lost all that weight.
I have to say, I don't know who you are.
I know. I was going to say, yeah, I got my hair cut short.
I think people could come in and just, what is it called, punk you,
Yeah.
And then some thin person could come in and say, I had your surgery 2 years ago.
Yeah, well, like I said, people don't recognize me, and I had one picture. I actually had a couple pictures in a book on the airplane, and I can't find them, so the plane, it's either on the plane or somewhere else, but I had one because, like I said, my son was, he's 21 today, and the day before the surgery, here's the picture. This is a bad one, but we went down to Slots for fun and had a hot dog.
I remember her. Wow.
So, yeah, so anyway, and... so yeah, it was, it's quite the difference. So, yeah, if you want to look at this terrible picture, it's, yeah. But anyway, I went back there last night, but I didn't have the hot dog because they're not the same hot dogs anyway. But you do have different tastes now, that's for sure. So, anyway, that's me.
Dr. Jolie's